So the AARP has a lot of resources that you can do. I heard there's a center over in Utica now where you can go and get tested, and
Oh,
it
I did
does
not know that.
visual feed. It looks at your reaction time and things like that. So they do it not just for seniors, but they actually do it for teenagers to see if they're able to process more than one step at a time, which I think is a great resource. So
We were talking last week, Jen's son is going to be turning 16.
God bless us all.
Yeah, God bless everybody in Oxford. And I think he's a fine driver.
Actually, he's very cautious. For being a boy, he's extremely cautious, which is, I'm very blessed with that.
Yeah, they actually tell you now when you're getting ready to back up out of anywhere to put your windows down so you can hear if someone screams or does whatever. Because with the windows up nowadays, the way their cars are sound, you can't hear. So they say put your windows down so that you can hear. Don't always rely on your cameras.
Yep.
And your rear. You still need to be
Kids,
cognizant of
animals, they can be on the ground, out of the camera range and things like that. And they were teaching the kids, keep your windows down so you can be attuned to all those things going on, which I think is a great thing because kids are very, very distracted these days.
Yeah.
So yearly screening and things to talk about with your practitioner, whether they're a doctor or a nurse practitioner or PA, is that mammograms I know that women are directed to mammograms, but I was sharing last week that my father-in-law, his mother had an aggressive form of breast cancer more than once. So him and his brothers, they all have to get a yearly mammogram as well. So a mammogram may not just be for women. Bone density, I think we'll have a slide in a minute about that, but they can test your bone density to tell you, are you more prone to osteoporosis? Diabetes, when you're having your labs done, make sure if they're going to do a proper diabetes test that it's a fasting, which means that you haven't had anything to eat or drink before the lab gets drawn.
I have a question about that. When you go for your yearly blood work, does that, and it's always a fasting one, does that automatically test then your diabetes level?
Usually they'll test fasting blood sugar.
Right, and that kind of lets you know.
If there is any issue or any inclination that you might be heading towards prediabetes, they will do what's called an A1C, and that gives the average blood sugar over the past 3 months, so you know with a number if you're heading towards a pre-diabetic state or if you're still in a good state. 2/3 of the people in the world, by the time they hit 65, will be either pre-diabetic or heading right there. And
what number is pre-diabetic for A1C?
I think it's
6.8.
Yeah,
I think.
it's so it's
Oh, I'm good then.
yeah, so it's up there, and they want you to be below. Like most people are medicated or like 7.1 and above, and I'm not talking like we talked earlier about Ozempic and stuff. That's not 7.1. That's like 12 something. They usually put you on that. But
My mom, 10.2 or whatever, yeah.
And that's somebody who has really not paid attention to their eating habits whatsoever, or paid too close of attention, and we're at Cook's Farm with me on a daily basis.
But the basic fasting blood work that
They'll be
is part of it does at least get the initial
yes.
blood check, so that
Yep. And if it's not fasting, then it's not going to be accurate.
No.
So, yeah. Because, hearing, vision, dental, colorectal, we're going to go with, here's your mammogram guidelines. At age 40, you should start screening. Between 45 and 54, they get it every year. Over 55, sometimes you can switch to every other year. It really depends on your family history, your genetics, and what's going on in your family. So sometimes your practitioner will say any changes in your family's health, any new diagnosis of cancer, stuff like that. Diabetes, Anne-Marie was talking about it, that A1C, you want to make sure you also get your liver levels checked. So before, you were just discussing Bachelor number 1 that they want to put you on statin. So it's important to know where your liver's at because your liver's going to be affected by that medication. So before you say yes, yay or nay, it's good to know how, since your liver processes your cholesterol, it's also going to process your drugs. So what's going on with that? If you have a blood pressure cuff that you're using at home to check yourself, take it with you to your appointment. Because yes, some patients, we might have white coat syndrome, which means that when we go at home, it's perfectly fine. And then we get into the doctor's office and it's really, really high. But your cuff could be wrong too. So it's important, whatever cuff you're using at home, take it with you and they can calibrate it in the office for you to tell you how accurate it is.
You know, too, another thing with diabetics people, they have to really watch their kidneys, how they're
Yes.
functioning. And don't be taking Motrin or Aleve, because that's not good for a diabetic's kidneys. You should only be taking a Tylenol. Well, we talked about that last time.
That's okay, yep. It is, there are different medications and different combinations of medications because there's a lot of blood pressure medications that get processed through your kidneys. And it's the same thing, is that you want to be careful, and sometimes you want to have a good sit down with your doctor and go over your medications and what is affected by what. Because combinations can change your kidney, your liver function, things like that. Yep, you're very correct. Bone density, so some doctor's offices will have this in the office, some will not, but they're looking at a T-score and a Z-score, and the lower, if you're between a -1 and a 1, that means you have normal density. If you're anything below that -1, that means you're at risk for osteoporosis. And that's when your doctor is going to talk to you about making sure that you're doing exercise, keep her moving. So weight-bearing exercises help build bone density. Taking your vitamins like your calcium and your magnesium to help build up your vitamin D, getting the sunshine when we actually have it, which today, look, we have like a nice sliver. So that's amazing. But also when we talk about sunshine, Anne-Marie does not like the sun. It is not her friend. So making sure you're using your sunscreen and wearing your hats and covering appropriately. Dermatology, looking at your skin, making sure your doctor's looking at your skin. We have smartphones now and we have charts that you can get in and out of. So if you notice a funny pimple or a different skin patch or something like that, take a picture of it. Send it into your doctor's electronic portal if you want, but make that appointment. Make sure that you're looking at your skin. And the one thing, and I'm terrible about this too, because once I get working outside in the garden, I don't want to like stop, but making sure that you're reapplying that sunscreen to protect yourself, because skin cancer is for real and it's increasing every day. All right, so we have Blanche Devereaux. This is Anne-Marie's favorite. She was a candy stripper. So with the day and age of medications, ladies and gentlemen, we want to be smart. Actually, STDs are the #1 disease process, even more than cancer, that are growing. If anybody's heard the villages in Florida, yeah. All right. So they're notorious for this, and seniors think that they're automatically protected, but you want to be smart. You want to have an open conversation with your partner. Maybe you want to get some blood work done before you have relations, but they can also do cheek swabs for certain disease processes. There's new medications like Cialis and Viagra that patients can take, both men and women. Don't be shy, be honest with your healthcare provider, because you want to protect yourself and you want to stay healthy for a long period of time.
And if your partner says, no, I'm not getting checked, make sure it's not your partner.
Yep.
So you don't need that in your life.
Nope. Dental. So dental, remember that your teeth are the way to your heart. So a lot of times, does anybody have to take an antibiotic before they get their teeth cleaned? Okay. Yep. So people with heart valves, other conditions, maybe they've had new knees or hips or things like that. So a lot of times, like I like to share, my dad had a new heart valve last fall, and before he could even entertain getting a new heart valve, he had to get all his teeth fixed and repaired. He had quite a bit of damage in Vietnam. So he had to get some crowns and some implants and things like that, because your dental health affects your heart health. So see your dentist. If depending on your insurance, you may need to talk to a Medicare or Medicaid specialist about gap coverage, because I know not everything is covered.
They have riders, right?
Yep,
They
there's
have
rider
riders
policies.
for health or eye and dental, for optical and dental.
Eh,
HARP has dental insurance you can purchase too.
Yep, HARP does.
And if you don't have insurance, you don't have a rider, or you end up getting something that is, you need, that's way too expensive, there's low or no cost at places that have dental schools. So St. Joe's, AKA Trinity, has a program. U of M has a program. U of D has a program. And you can get your teeth cleaned, you can get cavities filled, you can get bridges, crowns, root canals, and they're done by students who are ready to graduate. So it's like having a student nurse. There's always a real nurse right with them, keeping an eye. They're never by themselves doing anything. So a student would be working with you or on you with a with a dentist right there.
Had a guy at work that about 20 years ago, 59 years old, married 16, 17-year-old daughters, and he was paranoid of dentists. And he had an infection on a molar that needed to be pulled. And he put it off, where it finally got to the point where he couldn't function. Went to the dentist, and the dentist sent him directly to U of M, and they had to put him on an antibiotic, pull the tooth, but he died.
Yeah.
Poison got into
Sepsis.
his system.
Yep.
And they couldn't fight it.
Yeah. There's a lot of people, you get your teeth cleaned if you need to have an antibiotic and you don't have that antibiotic. You can get a bacterial infection that goes right into your heart, and it has killed people. So you can poo-poo and say, I'm just going to get my teeth cleaned. Yeah, you're going to get your teeth cleaned. Take your dang, yeah, and if you have any artificial
My
joints,
brother had a knee replacement younger than me, and my dad, when he was alive, had an infection from the cancer treatment when he was 91, 92. But my brother wasn't listening, he just had a knee replacement, and we had to put some gauze on him and bandage him at home. He caught, and my sister-in-law is a nurse, and said, you can't do this with your dad. And he was very stubborn about it. Long story short, he caught the infection, went to the knee. It was only like 4 months, 5 months after he had it done. It got into the knee. He was on antibiotics for like 6 months. They couldn't kill it because they said the bug got into the knee and was hiding.
Yeah.
So they had to go in there and take the knee out, the
Yeah.
replacement knee out, and put a new one in.
yep.
And
Yeah.
Let me just say, I did it once, I'm not doing it again.
Yeah. Yeah.
I'm not doing it again.
My husband's college roommate, his mom had, it started with a fall. So one of the F-bombs we talked about started with a fall, broken hip. She went through rehab, but she didn't use her device as she was supposed to. Got home between Christmas and New Year's, she fell again, broke her back, and they had to put in a rod and some pins. And she was in horrendous pain. She was failing at the rehab facility. She really, don't we all, we just want to go home and sleep in our own bed and be in our, yeah. Well, she was getting really frustrated, and she ended up at one of the local hospitals, and all her pins were infected. She had maintained an infection, and they had to take it all back out and do it all over again.
Yeah,
So
not good.
she's just now, it's been 6 months. So she just had her surgery 3 weeks ago, the second surgery. So she's just now starting to rehab and be successful at it.
She had daily pain killing. Does she take daily pain?
She's on painkillers right now, but actually the most pain was from the infected material. She feels so much better having had the hardware out, that it's actually, that was the biggest pain relief for her.
What
So,
was it that she wasn't using and she got the?
Probably her walker, her wheelchair,
yeah,
or her
she
walker,
had-
or her
she
cane.
had a walker and she didn't want to use it, and they live in a 1970s tri-level, step up here, step down here. So she was leaning on things, and
And then
Slip.
fell and got infection through that other.
possibly, it's one of those things.
Don't we wish we knew exactly where they all came from, but we don't.
Sometimes
Yeah.
doctors, they're educated, but they don't know.
Yeah.
Yeah.
Yep.
So another thing, thinking of poo-poo,
Yep.
is that depending on your age and your risk factor, between 45 and 75, you should be getting screened for colorectal cancer. So sometimes we're getting that nice colonoscopy. Sometimes we can poop in a box,
Yep,
depending.
we talk about poop in a box.
I
Yep.
like that. I had two colonoscopies in the 50s, 60s, and my doctor, Crosley up there, she said, Jim, it's been 4 years, but we need to give you the Cologuard. And it tested positive,
Yeah.
and
We talked-
it was a bad
We
test.
talked about that.
I
They,
had to go through it a third time.
Yep. There's a lot of false positives and false negatives. So if you really seriously want to know and you have an issue or you've had any history, poop in a box is not for you. So, yeah.
Don't recommend it to anyone.
Yeah.
Yep.
Just do the I always tell everybody when I'm done with my colonoscopies, because I have them quite frequently, I love it because my belly's all flat and I walk around doing all, I'm like, look at me. And then I go on System Fill and within a day I'm back to being a, but it's good for the day.
You got your beach body
I got my
back,
beach
right?
body for one
beach
day.
body back. And then I always like to do too, so that my father-in-law is 81 now, and he had just his last colonoscopy last year. They told him, guess what? You don't have to come back anymore unless you're having problems. And he's like, what? So he's graduated at 81. Unless he has problems, he does not need to get a colonoscopy anymore. So.
It's the 75 plus.
75 plus is usually the age where they say you don't necessarily,
That's it.
Unless you have
Yeah.
problems.
unless you're having troubles. Advanced directives, this is a whole nother conversation, but we're gonna just, Anne Marie is the best at this, so.
Absolutely, I've always wanted to do a dinner with death, that's what I wanted to call it, but no one ever wanted to come to that. So it's just about making sure, I was a hospice nurse for 4 years, just making sure that people in your family and whoever is your respected and trusted person, it does not have to be a family member, knows your wishes, knows if you want to be put on ventilators or have feeding tubes, whatever the case may be. They're called durable power of attorneys for healthcare. They have nothing to do with your checkbook. They cannot write checks. They cannot get into your money. They can't sell your house. All they can do is if you become unable to make your own medical decisions, you've talked with them, they know what you want, and you tell the doctor what their wishes are. You can write it down. There's a booklet called 5 Wishes. And this booklet you can get online. They'll mail it to you. It is a simple booklet made of almost stick figures. It's so spelled out A through Z and tells you exactly, you check, you initial, you sign with whoever your DPOA is, your durable power of attorney for healthcare, and you make sure that people know you have it. So you can make copies of it, put it on your phone, give it to your kids, make sure whoever your durable power of attorney is has that. Bring it to your PCP, your doctor. They can put it in your chart, and then everybody knows, and you don't go into a hospital situation, find your dad, mom, loved one, and they're hooked up to a ventilator with a bunch of stuff, and you go, they never wanted any of this. And then what do you do? So if you make sure your wishes are known, I've had mine done since I was in my 30s. And probably because I worked in healthcare and I saw so many things that they could have been avoided.
They split up, I heard a story of split up the family.
But
The wife's husband had to, I don't guess he had to do the decision she had, but the sisters, they didn't agree.
that's why you
Never
only,
talked to
you,
them again.
yep,
Yeah.
you have one durable power of attorney. And like I said, sometimes it's not your spouse or not your child, but somebody who agrees and who says, you don't even have to agree with the person of what they're choosing. You just have to make sure that their wishes are fulfilled.
Correct.
And that's it.
So the advanced directive, if you give it to one medical person, will it, for instance, the Beaumont chart, would that be then seen by everybody?
Maybe.
Or do you have to give it to everyone?
Usually
Maybe,
you have
yeah.
to give it to every doctor.
Yes.
To be very, but they can request records, but if there's an urgent need to look it up, it's not gonna happen that fast. So I, honestly carry it with you in your purse
They have
or your glove compartment.
Yep, they have little
Pocket cards.
pocket cards, like for your wallet. So you can put them with your driver's license that might say, yes, I'm an organ donor, or no, I'm going to my grave with everything, whatever, it says. you can have it right in there so that they know at least to look, and though with the 5 wishes. It comes along in the book so that there's a little tiny pocket card you can cut out and put in your wallet.
Yeah.
Advance directive is pages, it's got several pages to it. though.
That might be your living will. Advanced directives, living will, and that might have to do with a lot. The one I'm talking about here for advanced directive planning is for medical decisions only. So it is actually a booklet of maybe 20 pages, but it's simple paragraphs
There's a
on
lot of
each
explanation.
page.
There's not like, it's not all like you have to write out for every scenario.
No.
But yeah. So, and for me, I have 3 other siblings, and I'm going to be very honest that we're not all medical. We don't see eye to eye. For me, I like it because then in the situation you were discussing that it can tear families apart, is that I know for mom and dad, this is what they wanted. These are their wishes, and I'm honoring them. And then my sister can't say, "Oh, why did you do that to mom?" Or "Why didn't you do that to dad?"
Why did you kill mom?
You
Why
know?
did you let
So
mom die or whatever?
It can, unfortunately, emergency medical situations can bring out the worst in families. And so this way, we're all on the same page. It's mom and dad have spelled out what they want, and this is, I'm honoring it. So it's a good thing to have.
Clarkston's having the class
Yes,
on 5 wishes
In June, I think.
in June.
Yep.
So I know that they will let people from other neighboring areas,
It's $4 if you're not a member, $2 if you're a member.
and you'll go home with your booklet.
I was gonna say, I recommend that sometimes it gets a little pricey, a revocable trust. You can define whatever you wanna do with all your assets.
Right.
And medical, and nobody can override that.
Yeah, they have those, and most senior centers do have lawyers that come out and do speeches
Mm-hmm.
and talks and help you get those things situated. Wow, we should have been lawyers instead of
We
nurses.
should have been lawyers,
Yeah.
darn it.
But the one thing about nursing and about just healthy anything, and you don't have to be old to have your advanced directives taken care of. Because I did mine in my early 30s.
Yeah, I did mine before
So,
kids, just
yep.
so,
When our kids were young.
yeah.
Yeah.
Because,
Yep.
we wanted to know what was going to happen. And I love my husband, but I have another friend that's a nurse that's going to be making my decisions if I can. And know that that's only if you cannot make your own decisions.
Right, and
So
that's a doctor saying, no,
yeah.
she's out of her mind.
Yeah.
Then you get somebody, then you get the other
On
person.
that thought, when I did my revocable trust 12 years ago, it was explained to me at that time, I needed 2 doctors. So like say my one daughter says, Dad's not capable of handling himself. The other one says, yeah, Dad can. That you have to have 2 doctors to diagnose me that I'm not capable.
Correct.
Is it still 2 doctors?
Yes,
Yeah,
yeah,
I
you
was
have to
gonna
have
say,
2
I think-
opinions independent of each other, come in, and one, and not to scare anybody, but one is sometimes a psychiatrist or a psychologist, and the other is usually like a general medical, and they'll come in and ask a series of questions to determine, like, are you capable of making those decisions or not? So, yep. And then finally, our last slide is keep her moving.
Yep.
We all
Brain
wanna
and
keep
body.
doing, yep. AARP has free games online for like math and puzzles and
Word games, whatever, play Scrabble, do words with friends on your phone, play things that entertain your brain, Yeah,
Mexican trade.
yeah, you have to
Mexican
think there, you have to match and not everybody is a math person. Sometimes you need to color, what are those paint color
Oh,
things?
yes.
Mama love those. So you just, touch and you paint and you end up with this beautiful picture.
picture
and-
at the end.
Numbers.
It's
Yeah,
very
paint by number
soothing.
or color by
Yep.
number. And
Take-
it's just something that for your brain.
Yeah, take classes, go to the library. If you don't have, get out and walk. If you can't get out and walk, sit in your chair and lift. Anne Marie said soup cans or
whatever you have.
things of beans, like,
Water jugs.
Water-
1 gallon of water weighs almost 8 pounds.
Yeah.
So if you have 2 gallons of water and you've worked up to 8 pounds, good for you,
They have silver sneakers here.
Yep. And line dancing's going on next door right
Yeah,
now. I
really.
was listening to the music.
We were getting ready to go do the electric slide. We were just, But we've decided to stay here.
Yeah, we're gonna go line dancing next. So,
Oh.
but keep moving, keep active, build a circle of friends. It gets harder as we get older to build those friendships, but you know, come to these things, take an activity, build your circle of friends, because your friends are gonna keep you active and keep you moving and keep your brain strong. So it's when, you know, I like to use my in-laws as an example, is that since COVID, they've really kind of locked themselves away in their condo, and they don't really go out. And we're really starting to see some of the effects on my mother-in-law. She's really been struggling. She hasn't left the house in 8 weeks. And like, then you get caught into that loop of the anxiety of leaving. So stay as active as you can for as long as you can. So keep her moving.
And now about Let Us Drive. Here we
Yeah.
are. When you have an appointment, your kids, not that they can't, but maybe you don't want to bother them, or they aren't medical and you don't want them to go with you to your colonoscopy or whatever, you would call us, and we don't take insurance, but we would pick you up on time, and we have you sign a few forms that says it's okay for the doctor to talk to us. We would take you to your appointment. We would get all the information, ask the questions that we would as if you were my own family member. Then we come home, we make sure that you have any new prescriptions that you may have to pick up, whatever. You're comfortable at home, and then we will write an email or call your family to let them know exactly what happened for the day. We charge $75 for the first hour. We don't do we don't pay miles, or we don't charge miles. So we've picked up people in Flint and Grand Blanc and Detroit. Mileage really is not a thing for us. We just do $75 from the time we pick you up. The hour starts. It's a 1 hour minimum, and then it's $50 an hour therefore after.
Yeah. And then, the nice thing is that unlike other ride services, we stay with you the entire time. Sometimes you'll have a procedure or a surgery where they're like, you have to have somebody stay. We can be that person. We have some patients that they're a guardian case, which means they don't have any family living yet so we pick them up, we take them, and then we report back to the guardian. Sometimes we have patients that their family is completely out of state. They have no idea what's going on. So we pick the person up, we take them, we stay with them, we take them back home, again, make sure they have everything they need, and then we call the family and tell them what's going on and what the follow-up's gonna be.
We've been with one lady, we took her for her breast biopsy, took her for her port insert, through every chemo, every follow-up
complication.
appointment, we took her for the mastectomy, we took her for the port removal, and each time we'll send a picture of me and the patient sitting there eating Frosties, because that's what she loves.
That's the
going to.
only thing she wanted.
The Wendy.
which-
She said, can we go to the Wendy? She has no idea of my name or anything, but she always knows that when she sees me, we're going to the Wendy. So we go and we get our Frosties, and we send a selfie back to the guardian so she can see that we're happy and healthy.
But we followed her for almost 2 years now.
Yep.
So yeah, and she's still with us. And so
Yep.
we like to treat our patients like they're our family, because that's how we would want our family treated. So
Yeah.
that's our little
That's our goal.
shtick. Yep. So any questions at all for us today? We thank you
No.
for coming.
Thank you
Oh, that's all right.
information.